We're Sencha Health. We're in the business of streamlining and automating processes and have even automated the production of new software. Today, we are going to talk generally about the state of health insurance in the US and prior authorization specifically. In this video, we're going to discuss what prior authorization is as it relates to health insurance, why it matters, and how to improve patient care and reduce costs with or without prior authorization. All referenced work will be cited in the pinned comments. Prior authorization is a cost control tactic requiring physicians or practices to obtain approval from a health insurance company before a treatment qualifies for coverage. We will demonstrate how prior authorization affects patient care, timely, or any treatments and workforce productivity at the hospital and practice. The American Medical Association issued a press release recently that is quoted almost verbatim below and states, quote, "Access to patient-centered care continues to suffer as health insurance companies impose prior authorization barriers on necessary care and substitute corporate policy for clinical decisions that are in patients' best interest. Turmoil caused by excessive authorization controls leads to serious or life-threatening events for patients, unnecessary waste, and physician burnout, according to the latest survey from the American Medical Association." End quote. The delay in patient care alone is dangerous or sometimes deadly to the patient. AMA President Dr. Bruce A. Scott wrote in his viewpoint, quote, "Payers erect roadblocks and hurdles allegedly designed to save money for the health system and protect precious resources, but when patients and their doctors face care delays or even give up and abandon necessary care, the result can actually be increased overall costs when worsening health conditions force patients to seek urgent or emergency treatment. Our patients are caught in the middle, twisting in the wind, while physicians fight for them, often with fax machines as our only available weapon." End quote. The AMA survey results illustrate that delayed and disrupted care has become a predictable and miserable part of the patient experience, as widespread use of prior authorization programs by the health insurance industry continues to negatively impact the delivery of necessary medical treatments, jeopardize quality care, and harm patients. Nearly 1 in 4 physicians, 24%, reported that prior authorization has led to a serious adverse event for a patient in their care, including hospitalization, permanent impairment, or death. Bad outcomes. More than 9 in 10 physicians, 93%, reported that prior authorization has a negative impact on patient clinical outcomes. Delayed care. More than 9 in 10 physicians, 94%, reported that prior authorization delays access to necessary care. Disrupted care. More than 3/4 of physicians, 78%, reported that patients abandon treatment due to authorization struggles with health insurers. Lost workforce productivity. More than half of physicians, 53%, who cared for patients in the workforce, reported that prior authorizations had impeded a patient's job performance. Further, physicians reported high administrative burdens across major health plans when complying with prior authorization requirements and appeal procedures, forcing time and effort to be redirected away from patient care. The burdensome administrative duties consume scarce resources and significantly contribute to physician burnout. Added burden. Physicians reported completing an average of 43 prior authorizations per week, and more than a quarter, 27% of physicians reported that prior authorization requests are often or always denied. Diverted time and resources. Prior authorization requirements for a single physician consume the equivalent of 12 hours of physician and staff time each week, and more than a third, 35% of physicians employ staff members to work exclusively on tasks associated with prior authorization. Burnout factor. More than 9 in 10 physicians, 95%, reported that prior authorization somewhat or significantly increases physician burnout. Not only does prior authorization negatively impact patient-centered care and adds to crushing administrative burdens on physicians, the AMA survey found it also adds significant waste and cost to the entire health system. Wasted health resources. More than 4 in 5 physicians, 87%, reported that prior authorization requirements lead to higher overall utilization of healthcare resources, resulting in unnecessary waste rather than cost savings. More specifically, physicians reported resources were diverted to ineffective initial treatments, 69%, additional office visits, 68%, urgent or emergency care, 42%, and hospitalizations, 29%, due to prior authorization requirements. Despite mounting evidence that prior authorizations for drugs and medical services can be a hazardous and burdensome obstacle to patient-centered care, the AMA survey found that the health insurer industry continues to show ineffectual follow-through on 5 key reforms that were mutually agreed to in January 2018 by the AMA and other national organizations representing pharmacists, medical groups, hospitals, and health insurers. Given the health insurance industry's lack of progress toward voluntarily expediting comprehensive prior authorization reforms, the AMA has taken a leading role in advocating for state-level prior authorization reforms and strongly supports bipartisan and bicameral federal legislation to reform prior authorization procedures within Medicare Advantage, the Improving Seniors' Timely Access to Care Act of 2024. Dr. Scott continues, quote, "The time is now for Congress to adopt reintroduced prior authorization reform legislation that prioritizes patients' access to care, reduces administrative burdens on physicians, and preserves resources for high-quality care. Because insurers will not change their ways despite their rhetoric, lawmakers have an important opportunity to rein in excessive prior authorization requirements and unnecessary administrative obstacles between Medicare Advantage patients and evidence-based treatments." End quote. The AMA continues to work on every front to right-size prior authorization programs so that physicians can focus on patients rather than administrative burdens. Patients, physicians, and employers can learn more about reform efforts and share personal experiences with prior authorization at fixpriorauth.org. For those of you who follow us, you know exactly where we're going with this. Just like banks, insurance companies don't do anything. You pay your premium, they pay your medical expenses. Anything outside of this is malicious and designed solely to avoid fulfilling the contractual obligation to pay for your medical care. All the big buildings, all the equipment and energy, and most of all, people that you see working for an insurance company are there to simply avoid paying your medical treatments. Here is what we do. We create a new kind of insurance company that provides its own medical record system, electronic medical record, or EMR, to all the practices and all the hospitals of the world, free of charge. We then assign payments to all procedures in the EMR. When a physician documents a procedure, the insurance company sees the new claim and pays it. This eliminates all of the big buildings, equipment, and people that cost you money and avoids medical coding and billing at the practice, cutting approximately 47% out of the cost of your health insurance. How we got to 47% is out of scope for this article, but we have detailed the calculation before on this very platform in our channel. We and the AMA have documented the malicious greed of your health insurance company and shown how to improve patient care and reduce costs without prior authorization. Read the text version of this video on our newsletter site, sentchahealth.substack.com, or click the link to it in the pinned comment. All of the reference material will also be linked in the pinned comment. We appreciate your attention and help with promotion and invite you to tell us your thoughts in the comments. We will make every effort to read and answer every comment. Part of the reason we do this is to educate you and help you to educate others. Help us help you and every insured person in the world by clicking like and subscribe, telling the algorithm to show this to more people. Until next time.